Welcome back to Health Matters. Today, we're diving into a topic that affects millions worldwide: autoimmune diseases. We'll explore what autoimmune diseases are, common types, their symptoms, and more importantly, who is at risk and ways to control the disease. Let's get started. Autoimmune diseases occur when the immune system, which is designed to protect the body from harmful invaders, mistakenly targets its own healthy cells. This can lead to chronic inflammation and damage to various organs and tissues. Some autoimmune diseases only affect one part of the body, such as type 1 diabetes damaging the pancreas, while others like lupus can affect the whole body. While there are hundreds of autoimmune diseases, let's take a closer look at 8 of the more common ones. Type 1 diabetes, an autoimmune disease where the immune system destroys the insulin-producing cells in the pancreas that helps to regulate the amount of glucose in your blood. When these cells in your pancreas are destroyed, your other organs such as your heart and kidneys are also at risk as a result of the high blood sugar. Rheumatoid arthritis primarily affects the joints, causing pain, stiffness, soreness, and swelling. Although usually diagnosed in people when they get older, it can start when one is in their 30s. There is also a related condition, juvenile idiopathic arthritis, that can start in childhood. Systemic lupus erythematosus, an autoimmune disease that can affect various organs such as the skin, brain, kidney, joints, and heart, leading to fatigue, joint pain, and skin rashes. Although it sounds simple, SLE is the most common type of lupus and can be life-threatening in some cases. Multiple sclerosis, characterized by damage to the protective coating surrounding the nerve fibers in the central nervous system that will affect your brain and spinal cord, resulting in problems with walking and even moving independently. Hashimoto's thyroiditis affects the thyroid that produces hormones which help regulate many functions in your body. Hashimoto's thyroiditis usually leads to a decline in the hormone production, hypothyroidism, and some of the more common symptoms are fatigue, weight gain, and sensitivity to cold. Anyone can get this disease, but it is more commonly seen among middle-aged women. Psoriasis. Generally, skin cells grow and then shed when they are not needed. Psoriasis is a skin condition due to the rapid buildup of skin cells, resulting in thick, scaly patches that may appear to be red with silver-white scales on lighter skin tones and purplish to dark brown with gray scales. It is considered an autoimmune disease due to an overactive immune response. Inflammatory bowel disease refers to conditions that cause inflammation to the lining of the intestinal wall. There are different IBDs that affect different parts of your gastrointestinal tract, such as Crohn's disease that can cause inflammation to any part of your gastrointestinal tract, and ulcerative colitis which affects the colon and rectum. Symptoms may include abdominal pain, diarrhea, and weight loss. Celiac disease. This autoimmune disorder is triggered by the consumption of gluten, a protein found in wheat, barley, rye, and other grain products. It leads to an immune reaction in the small intestine when consumed, damaging the lining and causing digestive issues. Symptoms after consumption may include vomiting, diarrhea, constipation, and abdominal bleeding, and is said to affect 1% of people in the world. Autoimmune diseases can affect individuals of all ages and backgrounds, but certain factors may increase the risk. Firstly, family history plays a significant role, as having a relative with an autoimmune disease can increase the likelihood of developing one. Gender is also a factor, as many autoimmune diseases are more common in women. Environmental factors, such as exposure to certain toxins or infections, cigarette smoke, certain bacterial and viral infections may trigger autoimmune responses in genetically predisposed individuals. Some autoimmune diseases show a higher prevalence in specific ethnic groups. Lastly, your diet can also play an important role with regards to the risk and severity of this disease, along with other health conditions that you might have. It's important to note that while these factors can increase the risk, the development of an autoimmune disease is complex and often involves a combination of genetic and environmental factors. Regular medical checkups and maintaining a healthy lifestyle can help mitigate some of these risks. Unfortunately, there is no cure for most autoimmune diseases. There are, however, several treatment options aimed to manage symptoms and slow down disease progression. Medications such as anti-inflammatory drugs, immunosuppressants, and corticosteroids are often prescribed. Lifestyle changes like regular exercise, a balanced diet, stress management, and sufficient rest can also play a vital role in managing these conditions. Autoimmune diseases can have a significant impact on individuals and their quality of life. It is important to discover the signs, and if you suspect you or your loved ones may have an autoimmune condition, it's crucial to consult with a healthcare professional for proper diagnosis and treatment. Remember, understanding these diseases is the first step towards empowering ourselves and supporting those around us. If you like videos like these, check out the Health Matters channel.